This is Vijaya working as an assistant professor in KSR College of Arts and Science for Women. Today we are going to discuss some topic on nutritional assessment and diet counseling in clinical setting. Dietary assessment. Dietary assessment is the evaluation of food and nutrient intake to understand the dietary habit, nutritional status and plan intervention. Dietary survey method. It is a 24-hour recall method. There are many other methods. Let's discuss on it one by one. 24-hour recall method, which is a structured interview to recall all the food and beverage consumed over the past 24 hours, conducted by the trained interviewer. Its advantage is quick, low burden, and its limitation is relies on memory and honesty. Then food frequency questionnaire, which is used to assess the dietary intake over the long period of time, and a list of common foods is displayed, and it used to be semi-quantitative or qualitative. Its advantages captures the habitual intake, and its limitation is miss uncommon food, weight, food record or inventory. All the food and drink consumed is weighed and recorded over a period of time. Participant weigh and record before consumption. Accurate quantitative data but time consuming, requires high motivation, and the participant need to be an educated. Then food diary. Participant record all the food and beverage consumed over a week, and it is self-reported by the participant, including time, place and preparation, useful for the identified dietary pattern. Its limitation requires motivated participant. Food composition table. It is used to convert the food intake into the nutrient value. The tools used are ICMR, NIN, nutritive value of Indian food, and softwares like DietCal, NutriSurvey, and open platform for clinical nutrition. A manual estimation includes the portion size, and those portion size nutrient are calculated using that. Then rapid assessment tool. Rapid assessment tool includes the 24-hour recall, simplified food frequency questionnaire and observed checklist. It used in the emergency setting and time saving but not detailed. Nutrient intake estimation. It can be done by the record food intake, converting into grams and standard portion using food composition table and comparing with the RDA. Next, dietary diversity score. Dietary diversity score is a quantitative measure of food group variety consumed over 24 hours. Higher DDS correlates with the improved nutritional adequacy. Then scoring. FAO recommends the scoring based on number of food group consumed. Household level DDS. Focus on food security. Individual DDS, that is women diversity, dietary diversity score 10 food group, and child dietary diversity score 8 food group. Threshold. Minimum dietary diversity for women 5 out of 10, and minimum acceptable diet for child diversity plus frequency. The dietitian, ethics, responsibility, technology and education. Classification of dietitian. Dietitian are professionally trained in human nutrition and dietetics based on their work or area. Clinical dietitian works in the hospital. Community dietitian works in the public health program. Administrative dietitian manage food service system in institution. Research dietitian involves in the clinical research, and clinical dietitian often personalize. Consultant dietitian often personalize nutrition advice in private practice or freelancer. Then code of ethics for dietitian. Personal competence. Dietitian should maintain the updated knowledge, confidentiality. They should maintain some patient privacy, integrity and honesty, avoid misleading claims and unproven therapies, recommend only the scientifically validated process. Then responsibility to the public, promote public health and avoid discrimination. Interdisciplinary respect, which is collaborate respectfully with the healthcare teams, and ethical codes are often guided by the National Dietetic Association such as IDA and Academy of Nutrition and Dietetics. Responsibility of a dietitian. Responsibility of a dietitian include nutritional assessment, diet planning and prescription, nutritional counseling, monitoring and evaluation, team collaboration and administrative duties, and public health engagement. Teaching aids used by the dietitian. Common teaching aids used by the dietitian are charts, which is the visual display of food groups, leaflets and brochures, which includes the patient dietary tips and hygiene, healthy eating or breastfeeding practices, and posters which includes the key messages. Flip charts includes the group educational session, and especially in the rural setting. Model and sample includes food replicas, cooking demonstration and portion size, and audio visual aids, which includes the video, animation, recorded message for the larger audience. Factors affecting the individual food choices. Food choices is a complex process influenced by the combination of physical, psychological, social and economical and environmental factors. First, let us discuss this fact. Now let's work on these factors. Physiological factor, which includes the hunger, health condition, age and gender. Hunger means ghrelin and leptin hormone, which is appetite and satiety hormone. And health condition includes the diabetic, allergies, and age includes the biological age which and their activity level. Psychological factors includes the mood and emotion, which can be stress, depression, anxiety, and cultural beliefs and tradition, religious practices such as fasting, vegetarianism. Those are the factors. And social and cultural influences. Family and peer influence, social eating and upbringing, strong shape food habit, cultural norms, and economic factors include economic level and availability and accessibility, which is food insecurity, which is most common in the rural areas. And environmental and marketing factors include media and advertising, influences the perception of health and taste, which mostly influences the age group of toddlers and children. And convenience and time. Fast food or ready to make food can be easily chosen over the home cooked food, which due to its consumer time constriction and consumers acceptance and consideration of behavior modification. It is essential to modify the behavior of to change the dietary practice for particular condition or to initiate the healthy eating habit. Technique used are self-monitoring, which is keeping food diaries to recognizing pattern. Goal setting. The goals should be SMART goals, that is specific, measurable, achievable and relevant, time bound. Stimulus control. Positive reinforcement, that is rewarding healthy behavior with non-food incentives. And problem solving, cognitive reconstruction. Application in the weight management, diabetes, eating disorder and lifestyle intervention. Motivation in dietary changes. Type of motivation includes intrinsic, extrinsic, which is intrinsic is driven by the internal satisfaction, that is feeling better. Extrinsic is driven by the reward, example compliments, weight loss. Motivational strategies. Motivational strategies includes motivational interviewing. It helps to resolve ambulance and promotes the commitment to the change. Steps of changes include pre-contemplation, contemplation, preparation, action, maintenance. Pre-contemplation includes not ready to change, contemplation, thinking about changing, preparation, planning to change, action, actively making changes, and maintenance includes sustaining the changes. Thank you.